5, 6, 7, 8, 10, 13, 14, 15, 16. There you go. We got 8. Good morning. The committee will come to order. Thank you all for being here as we meet to mark an important piece of legislation, H.R. 4243, the VA Asset and Infrastructure Review, or AIR Act of 2017. I am proud to sponsor this bill, to have the strong support of the majority committee members, all of whom are co-sponsors of the VA AIR Act with me. This bill was introduced last week following months of careful consideration, has been the subject of multiple committee hearings and roundtables, and our partners on the Veteran Service Organizations and the Department of Veterans Affairs for helping us get here today. While our agenda is short with just one bill, I know we have a lot of ground to cover this morning. However, I do want to briefly comment on the elephant in the room, the H.R. 4242, the VA Care in the Community Act. As you all know, that bill, which every single member of this committee has co-sponsored, was originally included on today's markup agenda. After consultation with House leaders, I made the decision yesterday evening to pull the bill from consideration today because I had not yet received a formal cost estimate from the Congressional Budget Office and was not comfortable asking members to vote on final passage of a bill of this significance without some idea of the estimated costs. After I made that decision, CBO did provide a preliminary score on the bill, which I'm still reviewing. I want to be very clear. I wholeheartedly and without reservation support H.R. 4242, and I look forward to continuing to work with House leadership and the members of this committee to move it forward as soon as possible. With that said, I'll now yield to Ranking Member Walls for any opening comments that he may have.
Well, I thank the chairman, and we're going to have a discussion when we get into the AIR Act, but I wanted to be very clear. This committee and this week, as we move towards Veterans Day, proved once again 14 pieces of important legislation moved in a bipartisan manner, things to improve the lives of veterans, to improve the delivery of benefits, to hold VA accountable, and also to recognize where we're doing well. And the decision and the discussion we're going to have today, I would suggest is the most important decision that will be made in this committee in decades. It is going to shape the future of the VA and the delivery of care. And as we talk about the asset review, and we'll get into a little more detail once we discuss the bill, H.R. 4242, the Choice Act Improvement and Extensions, has to run in tandem with this. This is truly getting the cart in front of the horse if we do the AIR Act today without having the discussions. The decisions that are going to be made in the AIR Act are going to be driven by the data and what we do with 4242 in Choice. And we have operated, all of us, in good faith of moving this along with the intention of continuing. Language is changing constantly on both sides, and that shows that this is a healthy committee and getting there. But I am concerned that we're going to have to go back. We knew that the CBO score would matter. We knew when it comes back showing $40 billion over 5 years with a 10-year of above $100 billion that we're not going to find round downs to pay for that. That this is going to be a deep discussion that extends all the way into leadership of both sides of the aisle, that there's going to be decisions made on how we fund, what is mandatory, what is discretionary, and to do the asset review and move forward before any of those decisions are made are going, it truly is turning the Rubik's Cube, and now the colors are off. And so what I would ask is the same good faith effort that we've operated on all along, let's step back from it again. We did it with the GI Bill. We came back together and we put something forward that was a better product in the end, had the potential to pass the Senate and be signed by the President, and I think we're at one of those inflection moments today. So I thank the Chairman for continuing good faith efforts to get this right, and I would ask all members that today is, since many of us have been in Congress, this will lead us on a path that is one of the most important decisions that will be made in this room. So with that, I yield back.
I thank the gentleman for yielding, and I'll now call up H.R. 4243, the VA AIR Act. The clerk shall report.
H.R. 4243 to establish a commission for the purpose of making recommendations regarding the
Bill
modernization.
was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I think we all agree that addressing the serious and well-documented deficiencies in VA's capital asset portfolio and realigning VA medical facilities in light of significant shifts in both the veteran patient population and the delivery of medical care are vital to ensuring that veterans receive the timely, high-quality care, benefits, and services that they deserve from the Department of Veterans Affairs healthcare system. In that light, H.R. 4243 would authorize VA to establish an Asset and Infrastructure, or AIR Commission, to assess and make recommendations regarding the modernization and realignment of Veterans Health Administration facilities. As members know, this bill has been the subject of a full committee oversight hearing, a full committee roundtable, a full committee legislative hearing, and numerous other meetings and conversations over the last 3.5 months. I am immensely grateful to the committee members and VSOs who have worked closely with me over that time to ensure the bill before us is the right one. Based on their feedback, H.R. 4243 has changed considerably from the draft that was first discussed in July. For example, it would provide VA 5 full years to gather needed data, complete local capacity and market assessment, engage stakeholders, and stabilize community care efforts before recommending any facility modernization or realignment efforts to the Commission. Require 9 rather than 11 commissioners, with 3 commissioners coming from congressionally chartered membership-based VSOs. Require the Commission to be reflective of current demographics of veterans enrolled in the VA healthcare system. Require VA to consult with VSOs prior to publication of VA's criteria and extend the public comment period from those criteria from 30 days to 90 days. Require VA to consult with VSOs and local veterans when conducting the local capacity and commercial market assessments and when making recommendations regarding facility actions. Require the local capacity and commercial market assessments to consider the unique abilities of the federal health care to retain a presence in rural areas where commercial providers may not exist or at risk of leaving, as well as how gaps in VA care could be filled by expanding VA's internal capacity to provide care through extended hours, increased staffing, and/or construction, leasing, or sharing of VA medical facilities. Require the Commission to conduct public hearings in each region where VA has recommended a facility to be closed and to extend the regions impacted by other VA recommendations. Require that all proceedings, information, and deliberations of the Commission be available for review by the public. Require commissioners to serve without compensation. Require that information transmitted or received by VA, the Commission, or the President regarding the Commission or the Commission-related activities be made practically available online within 24 hours. Remove the requirement for witnesses at the Commission hearings to testify under oath. Amend the definition of modernization to include the construction, leasing, or sharing of facilities. Prohibit VA from pausing major or minor construction while the Commission is ongoing, and specify that unless Congress acts within the stated time frame to disapprove the Commission's recommendations, any major medical facility project or lease recommended by the Commission shall be considered to be congressionally authorized, and authorize VA, after consulting with VSOs, to include in future budget submissions following the termination of the Commission a recommendation for future commissions or other capital asset realignment or management processes. The bill would also authorize and appropriate $2.1 billion to the CHOICE program to ensure that veterans are able to continue assessing choice care while we continue to work to create a stronger permanent care in the community program. And this was agreed to previously between both sides, and to authorize and appropriate $500 million for VA minor and non-recurring maintenance projects to expand VA's in-house capacity to care for veteran patients, and finally, exempt recruitment, relocation, and retention incentives from limitations placed on awards and bonuses to VA employees to make it easier for VA to attract high-quality hires. And these 3 last things I mentioned we discussed in the at a previous time, and they were separated and put into this bill, and we certainly want to see this done. I do want to bring members' attention to language starting on page 36, line 17, through page 37, line 5, which would authorize VA to transfer funds appropriated to VA for any purpose in the AIR account with certain notice and approval requirements. According to CBO, that language has significant mandatory score implications. As a result, I would like to ask unanimous consent to strike it in full. Without objection, so ordered. I'm also proud to have all members, majority members of the committee join me as original co-sponsors of this bill and to have the support of the American Legion as well. H.R. 4243 is now open to amendment at any point, and Representative Sablon has an amendment at the desk. The clerk shall report.
An amendment to H.R. 4243 offered by Mr. Sablon of Northern Mariana Islands.
Unanimous consent that the formal reading of the amendment be dispensed with. Hearing no objection, so ordered. Representative Sablon is now recognized for 5 minutes to speak in support of his amendment.
Thank you very much, Mr. Chairman, and I thank you and the ranking member for the hard work that led up to what we thought was going to be the consideration of H.R. 4242 and H.R. 4243 to go in tandem. But having said that, I ask unanimous consent that wherever that the amendment reflects that the Commonwealth of Puerto Rico and the United States Virgin Islands being listed were in the definition of Pacific territories, just some technical changes, if that's...
Without objection, so ordered.
Thank you. Mr. Chairman, my amendment would require the VA Secretary to report to the House and Senate Veterans Affairs Committees on the care furnished by the VA to veterans living in the U.S. in the territories of American Samoa, Guam, the Northern Mariana Islands, Puerto Rico, and the U.S. Virgin Islands. The report must include an assessment of the VA's ability to provide hospital care, medical, mental health, and geriatric services, and a study of the feasibility of establishing a VA medical facility in the Northern Marianas, the only territory without one. The preliminary assessment from the CBO indicates the amendment has no direct spending or revenue effects. I have used my short time on this committee to bring attention to the lack of direct VA care and services to the veterans living in the Northern Marianas. In addition to being the only U.S. jurisdiction without a VA facility, there are also no dedicated VA medical or mental health care professionals to serve veterans. In reality, we have one administrative personnel. In the Northern Marianas, veterans must rely instead on community providers for the care and services they want to receive from the VA. Veterans in Guam and American Samoa, the U.S. Virgin Islands, and Puerto Rico also face challenges in accessing VA care and may at times have to travel thousands of miles to access quality care. Sons and daughters of the territory enlist in the armed forces at high rates, and they should receive the quality VA care they so rightfully deserve. The report required by my amendment would give this committee a clear picture of VA services available to the veterans in the territory so we can work towards solving the barriers to access and providing them with the quality VA health care they want where they reside. I appreciate the support of Chairman Rowe and Ranking Member Walz for my amendment and for helping me and bringing some information to my colleagues in this committee and into helping me get services available to the Northern Marianas, and in this case, to veterans in the 5 territories. Mr. Chairman, and I yield back. Thank you very much.
I thank gentlemen for yielding. Does anyone else wish to speak on Mr. Sablon's amendment? I will be supporting his amendment. Hearing no one else wishes to speak, Ms. Custer has an amendment at the desk. Clerk shall report.
An amendment to H.R. 4243 offered by Ms. Custer of New Hampshire.
Ms. Custer, you're now recognized for 5 minutes to speak in support of your amendment.
Thank you, Mr. Chairman. My amendment would ensure that any successor to the choice program would account for those states and territories that lack a full-service hospital. In 2014, when Congress came together in a show of bipartisan support, it provided specific eligibility rules for states like my home state of New Hampshire. As many of you are now aware, the Manchester VA Medical Center has recently been in the news. The Boston Globe published an expose based on the allegations of a group of whistleblowers that were also doctors at the facility. Secretary Shulkin and I took action to begin correcting the situation in Manchester. The Secretary removed the director and the chief of staff and created a task force to seek improvements to the quality of care at the facility. With the leadership of my esteemed colleague, General Bergman, we held a field hearing in New Hampshire, and I want to thank General Bergman for making the trip. Subsequently, I requested that leadership in a task force be changed, and encouragingly, the Secretary has complied. Most recently, I led the New Hampshire delegation in requesting the construction of improved women's health care clinic after women veterans at an American Legion town hall on July 31st described wholly insufficient facilities for their needs, especially at the needs born from sexual trauma in the military. Due to our request, the VA has now agreed to construct a new women's clinic at the Manchester VA. Yet despite these improvements, Manchester still will need additional resources and support. The vast majority of my Granite State veterans that use this facility are currently eligible for the choice program. More importantly, the Manchester facility, because it is not a full-service hospital, relies upon the choice program to provide the care that our veterans expect and deserve. While I'll continue to work to increase the available care at the Manchester facility, we must ensure that the VA will account for those important and unique situations where veterans cannot access care. Do not misunderstand me. My veterans want VA-based health care. Years ago, many in the northern region of my state, known as the North Country, were extremely disappointed that the VA reneged on a promise to build 2 CBOCs. When VA downsized the Manchester VA, many were disappointed by that decision as well. In fact, the delegation routinely introduces legislation that would require the VA to increase the Manchester facility to a full-service hospital. I remain concerned by the underlying bill and that it will in fact be worse for my veterans, a group that has already seen their resources pulled and promises rescinded. The choice program is so valuable to my constituency because it complements the care that they want and deserve. Mr. Chairman and colleagues on this committee, please remember veterans like those in the Granite State when you design these reforms. I am willing to withdraw my amendment today, but I welcome the opportunity to work with my colleagues on this committee to make sure that the choice program works for our veterans in New Hampshire. I ask that the chairman commit to working with me on this critical issue to address veteran care in states lacking full-service VA hospital. Thank you, Mr. Chairman. I yield back.
Gentlelady withdraws. I certainly will be more than willing to do that.
Thank you,
Thank the gentlelady.
Thank you, sir.
Ms. Brownlee has an amendment at the desk. Clerk shall report.
An amendment to H.R. 4243 offered by Ms. Brownlee of California.
Ms. Brownlee is not I ask unanimous consent to dispense with formal reading of the amendment, and hearing no objection so ordered. Ms. Brownlee is now recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. As we are talking about care in the community and reforming the choice program, which we all agree needs to be addressed, it's important that we don't overlook the internal needs of the VA. We need to make sure we're consistently investing in the VA to build the innovative 21st century agency that will serve a new generation of veterans. H.R. 4243 proposes a new BRAC-style process to close facilities that are no longer serving veteran needs. While I have some concerns about the process that this bill establishes, I do wholeheartedly agree that we need to address aging infrastructure and close facilities that are outdated. However, closing outdated facilities is only one half of the equation. Our nation has been at war for nearly 2 decades, and we need to ensure that the VA is able to build or lease new hospitals and clinics to serve future veterans. We also need to ensure that when a facility closes, the VA has a plan for serving veterans in that area. In some places, that may mean opening a new but smaller hospital or clinic. In others, it may mean relocating a hospital or clinic closer to the veteran population. My amendment to H.R. 4243 would address this issue. Everyone on this committee is well aware of the bureaucratic barriers of authorizing new VA medical facility construction and leases. While VA sent Congress its annual request for new needed infrastructure improvements, it has taken us years to authorize VA to move forward. My amendment would solve this problem. It would allow the House and Senate Veteran Affairs Committee to approve new facilities via a committee resolution instead of legislation. This is the process that was previously used by the VA committee, and it is the process that is currently used by the Transportation and Infrastructure Committee and the General Services Administration for all other federal buildings. This small procedural change will make a big difference in the lives of veterans who are waiting for better access to care. There is simply no excuse for Congress to hold up needed VA clinics because of bureaucratic scoring disputes with CBO. This change is also supported by many of the VSOs and was recommended by the Commission on Care. The VA's inability to plan or execute leases for capital needs in a timely manner is a fundamental problem that needs a long-term solution. How will BRAC be useful at all if at the end of the whole process, the VA has to wait years and years to authorize new clinics? Mr. Chairman, I know you recognize the scope of the problem. You've said CBO should get the Forrest Gump Award for this approach to leases, and I couldn't agree more. We should be doing more, not less, to increase access to VA services, hire more providers, cut down wait times, and ensure that veterans are receiving higher quality care. I hope we can bring renewed attention to this critical health care issue for veterans and find a bipartisan way forward. And I, too, in the spirit of working together to get this right, if the chairman will agree to continue to working with me to solve this problem, I will withdraw the amendment at this time.
I thank the gentlelady for withdrawing her amendment. And just one comment, it's like nothing I've ever seen, how they do leases. I mean, nobody. It would be like me buying or leasing a condo here in D.C., except I've got to pay all 20 years of it or 5 years or whatever on day one, which is crazy. But H.R. 4243 does incorporate VA's legislative proposal regarding the definition of a VA major medical lease and automatically authorizes any lease that the Air Commission recommends. But I will be willing to work with, definitely want to work with you on that.
Thank you, Mr. Chairman.
I appreciate that. No other, see, hearing none, there were no other amendments timely filed, and the question now occurs on Representative Sablon's amendment to H.R. 4243. All of those in favor of Mr. Sablon's amendment say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it, and Representative Sablon's amendment to H.R. 4243 is agreed to. All the amendments have been withdrawn, I think.
Withdrawn. So now we go to the bill.
Oh, yeah. Do any members wish to comment on H.R. 4243 as amended? Mr. Walz.
Well, thank you, Mr. Chairman. And again, I want to thank all the members in here, especially the chairman, for the good faith effort of tackling what, again, once we can't say it enough, most important decision we'll make on the future of VA health care and how we deal with it. I think all of us know the gorilla in the room on this is, and the only reason we are not talking 4242 today is cost, and that's a pretty big gorilla. And this is a case of we're moving forward with asset review, we're moving forward with extension of choice, before we knew we were going to have this day come, how are we going to tackle both providing the funding for the core mission of the VA while modernizing it using care in the community? And we've worked together. We're very close. And I can tell you, I know we've done a good job, because I know on the majority side, it was a heavy lift. There's a lot of pressure from the outside to do even more, to push it more. And this committee resisted that to get something that could get done. On this side of the aisle, there's lots of pushing that you're moving to privatization. You're not taking these things into consideration. That pressure on all the members in here has been resisted to stay together and stay on track. That has not been derailed. But by doing this today, once this happens, all of you are professional at legislating. You know there's a sequence. You know that it requires strategic thinking. And you know the minute the leverage leaves and this ship sails, it's going to be much harder to do 4242. They were predicated on staying together and moving together. So once it leaves, now we're going to have to come back. This is the equivalent, for those of you who said on this, of separating a farm bill into farm programs and nutrition titles. Building the coalition to get it done, and one predicated on the other, is the only way many times we get this done. So I'm disappointed. I don't totally agree with the style that we were doing the AIR Act, but I've stayed with us working on this. I think we need to be more focused on needs of future trend lines, system analysis, holistic approach to this. One of the things that I hope all of you know is this bill gives immense power and authority to the President, and it affects every single one of our districts. And I got to be honest with you, I don't trust any president to know what's best for my district. I do trust you to know what's best for your district. I would and was willing to try and work to overlook those things if we were able to point to an improved care in the community bill that would be the template that the Secretary would use to gather the recommendations that they would make to the President. That is now hopeful that that will happen. We're going to have to come back at it. This is already gone and going to the floor. So those recommendations are based on that model of care is going to have us miss the mark on what the VA needs. And so I would encourage all of you, we've done it before. There is no place in Congress that can do this. Take a step back from this. Let us come back at this again. Let us work in good faith to have the conversation on the pay for, on what we're going to do for care in the community. And the disagreements are not so great that we couldn't get there, because we all have been focused on, and this is why I applaud everyone who's sitting here today, the considerations are what's best for the veteran, what is the best way to deliver quality care with the least resistance to the veterans, but we have a responsibility to pay for it. And if we continue to not talk about it, those of you, and there's a few of you sitting here, were on the conference committee when we did the Choice Act in its origin after the Phoenix VA. For some of you who want to know why it was that ridiculous 40-mile issue or 30 days, it's because the CBO score came back just like this one did, and everybody said, oh my God, $100 billion a year? How about 50 miles? No, that's too much. We just kept lowering it down, totally divorced from what was best for veterans to try and fit the score. We are now setting the path that that's exactly where we are again. So I would encourage members not to vote no to derail the bill, to vote no to ensure that it actually gets enacted in law and improves veterans' care. And with that, I yield back.
Thank you, gentlemen, for yielding. General Bergman, you're recognized 5 minutes.
Thank you, Mr. Chairman. The VA's core mission has been and always will be to provide essential services and care for our veterans. In order to effectively carry out this mission, VA must be properly funded and have the processes and procedures in place to oversee its expenditures and asset management. When looking at how the department is funded, we need to understand where money is being wasted and identify areas where those resources should be redirected. We must also identify duplicative situations where resources are being spent on the same thing from two different angles. By establishing a nonpartisan panel to assess VHA assets, the AIR Act brings much-needed oversight to VA's infrastructure and asset management practices. Just as we're seeing our healthcare delivery systems change from a primarily inpatient setting to one with newer, more innovative technologies like telemedicine, so too must the VA and Congress adapt and change its overall mindset. We need to consider working in parallel working multiple issues in parallel rather than being linear. Veterans in Michigan's rural First District know how difficult it can be to access services and care in a timely, convenient setting. With the VA's infrastructure portfolio in need of serious repair and investment, we must look at where federal dollars are going to maximize care for all of our veterans, especially those currently in underserved and rural areas. Outdated and underutilized assets detract from VA's ability to establish a care model that addresses rural and low population areas. It also drains resources. As the chairman of the Oversight and Investigation Subcommittee, I look forward to working with the committee and the VA to ensure that this review is transparent and responsible with the ultimate goal of putting our veterans first. Mr. Chairman, I urge support of 4243 and I yield back.
Thank you, gentlemen, for yielding. Mr. Takano, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Well, I know we were all expecting a different markup this morning, and although we've hit some stumbling blocks, I hope we can continue to find a bipartisan path forward to resolving outstanding concerns about the future of veterans' care in the community. This committee has been a bright spot on the Congress, and we've strengthened the GI Bill, we've passed appeals modernization, and worked to improve accountability at the VA. And it's my hope that we can continue to work through our differences to find a solution that gives veterans the care they deserve and retains the VA's role as a coordinator of care. Now, this bill was to be worked in tandem with the Choice 2.0, and the CBO score that comes back to us today that shows nearly $40 billion 5 years out is simply not sustainable, and this is not, I think, an adequate offset, the AIR Act, especially in light of the fact that we keep continuing to having to approve more appropriations, more money for choice. The spend is going much faster than we thought, and we think we know that veterans are accessing the system, which is good. And because of the easier access, they're utilizing the system more. But this still does not solve the problem of VA's own internal capacity, which is still lacking. And I am concerned that this committee needs to pay just as much attention to that. And how we're going to make both Choice and the VA both sustainable, I think, is the big question. And where we're going to find the kind of money that the CBO is projecting that we're going to need, I think, is the big question of the day. But let me go back and just comment on the particulars of the asset review and the flaws that I see in the system. The Asset and Infrastructure Realignment Act has come a long way from earlier drafts we've seen, and I commend the chairman for being open to feedback from the VSOs and stakeholders. Still, I remain concerned that the legislation we're considering today undermines congressional oversight. Even if a majority of both houses disagree with the final recommendations of the Commission, the mechanisms for reviewing the Commission's final plan almost certainly guarantee it will be adopted. By the time Congress weighs in, the Commission has finalized its recommendations, and they have been approved by the President. If Congress disagrees, we send a joint resolution of disapproval back to the President, who by this time has already approved the proposal. Then all the President needs to do is veto the joint resolution. We would effectively need a veto-proof 2/3 majority in Congress to have a check on the Commission and the President. On such an important matter that impacts the health of veterans across the country, I am uncomfortable ceding this committee's and this Congress's oversight. Additionally, even although the timeline for the Commission to develop its recommendations have been pushed back, I'm afraid we're putting the cart before the horse by moving this legislation forward today. This committee is still grappling with a successor for the Choice program. As I highlighted earlier in my earlier remarks, a new plan that streamlines the eligibility and pathways for veterans to get their care in the community will have a significant effect on the VA's capacity needs. considering how to realign VA's facilities before we have the program up and running, let alone agreed to in Congress, seems like a recipe for disaster. I believe we need to complete our work on the community care legislation before we consider how best to realign VA's facilities and infrastructure. Again, I thank the chairman for his efforts to improve the bill. I hope this committee can keep doing what we do best, and that is to find a bipartisan solution that makes the VA more effective and efficient and guarantees veterans timely access to quality care in the setting that is best for them. And I yield back the balance of my time, Mr. Chairman.
I thank the gentleman for yielding. Mr. Poliquin, you are recognized for 5 minutes.
Mr. Chairman, thank you, Mr. Chairman. Appreciate it very much. I'd encourage everyone to support 4243. I will be supporting that bill. But I also want to note, Mr. Chairman, that there's an important piece of some important language, rather, in the bill that comes from my H.R. 3169 that I co-sponsored with Mr. Bergman, Mr. Kaufman, and Ms. Custer. And it deals specifically, Mr. Chairman, with strengthening the construction of facilities management capability of the folks at the VA. And this is going to be so important as we move forward to make sure that we have the right people in place, the right training, the right certification, such that they can move forward with this very important assessment of the physical assets that we have at the VA, making sure going forward we have the correct way and facilities to care for our veterans. So with that, sir, I'm in support of this bill, and thank you very much for the time. I yield back.
Thank you, gentlemen, for yielding. Does anyone else wish to speak? Yes, sir. Mr. Sablon, you're recognized.
Thank you very much, Mr. Chairman. Mr. Chairman, as early as Monday evening, we had a meeting and we had a discussion on today's markup that 2 bills are coming up. And Ranking Member Walz was very generous and sincere in acknowledging how much heavy lift you have taken in getting both bills towards the markup. And at the same time, he was also very sincere in asking us to sort of acknowledge that we in Congress, we legislate, thus we negotiate and oftentimes compromise. I have sincere admiration for the chairman. I'm also fine, associate myself with Mr. Takano's statement that this committee is indeed a gem in this Congress, that there's bipartisan work and cooperation. My amendment today is no longer mine alone. The territory of American Samoa, Guam, Puerto Rico, and the U.S. Virgin Islands are part of that amendment, so I couldn't withdraw my amendment, despite that I understand the difficulty of the now absence of the original agreement that 4242 and 4243 were going to be marked up today and acted upon and hopefully sent to the floor for full consideration. But I also see that there's a problem with the 4242, finding money to pay for it is going to be a problem. And so I want to thank everyone who supported my amendment. I have, in all sincerity, asked, and mean no disrespect to those of you who may find my final vote on this bill to be different from my vote on the amendment. But I thank you, everyone, for your support, your understanding, Mr. Chairman, and I yield back.
Thank you, gentlemen, for yielding. I know that we have discussed in my office the issues that you're dealing with, and you have my commitment to try to help you in that area. So you, Mr. Sablon, I understand very well where you're coming from and the lack of services that you have. So we will continue to work on your issue. Does anyone else wish to speak on the bill? Well, I'll close. I'll yield myself a few minutes here. Look, this committee, I have great confidence in this committee to do hard things. What we're doing here is really in the VA revolutionary. And so I think the committee is up to it, and I think we'll get this job done. I truly believe that. As I got this job as chairman, I said, I want to travel around and get a real feel and view. I know what my own VA looks like at home, but I wanted to go to others. And I've been to both Democrat districts and Republican districts to look and continue next week to travel out west to Spokane and Little Rock and southwestern Washington State to meet with VAs. And I'll continue to do that as long as I'm chairman. And I've realized something on the last trip. We've been doing some investigations in our committee. We'll send an investigative team out, as you know, to just with an hour's notice to look. And what I have found, one of the problems, a serious problem with the VA, is HR. And I didn't really appreciate how serious that was. And I was in Medford, Oregon about 3 weeks ago. They have 8 CBOCs there. But they actually have enough patients for 12. And they haven't been able to recruit for those. And I began to think in my own private practice of medicine, if we needed 4 more physician teams, we would go actively recruit those teams. But there's no incentive for the VA to go do that. In other words, my incentive in private practice was maybe I didn't make any more money, but I got a night or 2 off on the call schedule. So I benefited from growing my practice and doing that. If you have a team, a PAC team that you're the doctor in charge of, there's no incentive for you to grow that because you have your book of business of 1,000 or 1,200 people. And I think that filters all the way down through the system. So I think having this system review that we're talking about, not only is personnel, we talk about all these empty slots we have all the time. And one of the reasons, I think, is a material weakness in the HR practice of the VA right now, something we have not really talked about. Number 2, if you visited like I have, and many of you, I would encourage you to go do this. The country is very different, and we need a different model about how to practice medicine. It does need to be modernized. When you go to a Northport and you go to their hospital and you go by 2 older VA buildings that the roofs are falling in, it's embarrassing that a country like us that is spending $186 billion for veterans care have that kind of facility. That's not how you provide care in the 21st century. I think the VA is spot on correct when they're opening more and more CBOCs and making these bigger. Really facilities that can do up to minor surgery in there, I think is a very wise thing to do. And that's what the AIR Act would do, was say, let's get this right-sized. This was tried 14, 13 years ago, and that Congress was not successful. We will not have done our jobs if the VA looks like it looks now 25 years from now. We will have missed the mark. We will have been a failed committee. And I don't believe this committee will fail. I truly do not believe that. When we look at and I haven't had a chance to deep dive it, but only a preliminary view of the CBO score. Look, and Ms. Brownlee is correct. It boggles my brain when I look at CBO scores because this is not that complicated. We spent $9 billion on VA care, not choice care, last year. That's what we spent as a group. We spent about $4 billion on choice. That's what we spent. And I think next year we're going to do about the same thing plus an inflator. The Medicare does this every single year when they evaluate how their spending is going to be. That's the formula they have, which kicks in IPAB. You know you got this many people to see. You know you spent about this much money. There's an inflation rate. A few more people are going to be seen. It's not that complicated. So this CBO score included a lot of things that we're already doing and already paying for. It just wasn't on the book. So the actual care is going to be almost exactly what we said it was going to be. And we still have to find that we're already spending and budgeting the $9 billion. We've got to find the extra $4 billion a year for choice. And it is almost exactly the number I thought it would be. So I'm not concerned about that at all. We will find that, and we are going to continue choice. Now, this bill also has in it something we talked about in detail, and Mr. Takano brought up, is that we have a choice program. The idea of getting this all done so that September 30th or October 1, of next year of 2018, we can roll this out. Dr. Shulkin has been pretty good about getting us reports, and the burn rate is about what he said it would be. So in January, we're going to need $2.1 billion, or there are going to be veterans that don't get care again. So we have to get this $2.1 billion, and per our negotiation with you all and with the VSOs, there's an extra $500 million in there for non-recurring costs, some repairs that need to be done, some smaller projects that need to be done. We've agreed to do that along, and then Secretary Shulkin said, in addition, I need some authority to be able to recruit people, again, back to the HR, and we said, okay, we'll agree with that. That's what our side agreed to. And I think that's very necessary. Now, on the 4242, I'm telling you, the Community Care Act is, after a tremendous amount of work on both sides of the aisle, is going to be passed. And I'll tell you why. The President wants it. He said so. The administration wants it. Dr. Shulkin has worked hand in hand with us. We've had numerous meetings with his with the Secretary and his people about that. The committee leadership wants it. The minority leadership wants it. The Senate leadership wants it, and we're going to, because I went over yesterday and met with both Senator Tester and Senator Isaacson. They want it. They're working on it, and they may vote as early as next week, or it could be after the Thanksgiving break. Just depends on how they can move it forward. So I think this is necessary. This is hard. What I'm asking the committee to do today is hard, and it's hard because it needs to be done. And it needs to be done so that we can right-size the VA, modernize the VA to be the VA we can all be proud of, one that doesn't have wait lists, doesn't have people waiting in line to get in. We want a VA system that's responsive to the needs of our veteran patients. And I think with that, we should absolutely vote for this. The 4242 is coming. We're going to pass that, and we're going to find the financing to take care of our nation's veterans. We always have. So I want to thank you all, both sides. I obviously have great respect for my Democratic colleagues along with my Republican colleagues. And with that, I think we've finished the discussion. I'll now recognize Mr. Bilirakis for a motion of reporting H.R. 4243 as amended.
Mr. Chairman, I move favorably to favorably report H.R. 4243 as amended to the full House.
Thank you, Mr. Bilirakis. I would like to ask for a recorded vote. The clerk shall call the roll.
Mr. Chairman?
Aye.
Mr. Chairman votes aye. Mr. Bilirakis? Mr. Bilirakis votes aye. Mr. Kaufman? Mr. Kaufman votes aye. Dr. Winstrup? Dr. Winstrup votes aye. Ms. Radewagen? Ms. Radewagen? Mr. Boss?
Aye.
Mr. Boss votes aye. Mr. Poliquin?
Aye.
Mr. Poliquin votes aye. Dr. Dunn?
Aye.
Dr. Dunn votes aye. Mr. Arrington?
Aye.
Mr. Arrington votes aye. Mr. Rutherford? Mr. Rutherford votes aye. Mr. Higgins? Mr. Higgins votes aye. Mr. Bergman? Mr. Bergman votes aye. Mr. Banks? Mr. Banks votes aye. Ms. Gonzalez-Colon? Ms. Gonzalez-Colon votes aye. Ranking Member Walls?
No.
Ranking Member Walls votes no. Mr. Takano? Mr. Takano votes no. Ms. Brownlee?
No.
Ms. Brownlee votes no. Ms. Custer?
No.
Ms. Custer votes no. Mr. O'Rourke? Mr. O'Rourke votes no. Ms. Rice? Ms. Rice votes no. Mr. Correa? Mr. Correa votes no. Mr. Sablon? Mr. Sablon votes no. Ms. Esty? Ms. Esty votes no. And Mr. Peters? Mr. Peters votes no. Mr. Chairman, the vote is 13 ayes and 10 noes. The motion is agreed to.
Thank you. The motion is agreed to, and H.R. 4243 as amended is reported favorably to the House. Summarizing our efforts this morning, the committee has voted to report H.R. 4243 as amended favorably to the full House. I ask unanimous consent that the committee staff be authorized to make technical and clerical and conforming changes to the bills favorably reported today. Hearing no objections, so ordered. I also ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and insert extraneous material on any of the bills reported favorably today. Hearing no objections, so ordered. I thank the members for attendance, and the hearing is adjourned.
All right, thank you.
We'll continue.
We'll be back.
We'll be back.
We were at this point with GI Bill.
Well, exactly. I think we're...